Good evening, good afternoon, and good morning. This is the 545th day of continuous webinar conducted by International Forum for Promoting Homeopathy. We welcome all to the session. Today, our guest is Dr. AMI.C.SHAH. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathy lovers, students, and doctors, and we have 3 sessions every day. The first session of the day is already over in Hindi, and that begins from 7:30 to 8:30, and from 8:30 to 9:30, the international session in English, and from 9:30 to 10:30, we have a local language session in Malayalam. All these sessions are going in a good way, and we are uploading the videos of the same on the very next day itself. You can get it by searching IFPH Homeopathy in YouTube. And let us come to the today's session. And today our guest is Dr. AMI.C.SHAH, and she has completed her MD Homeopathy and Medica, and she has more than 3.5 years of teaching experience and nearly 7 years of clinical experience, and working as assistant professor Sri Mahalakshmi Mahila Homeopathic Medical College, Vadodara, Gujarat. And we'll be discussing an important subject, and that is the magnesium group of medicines in homeopathy. As you know, all these things are very good to uh, educate each and everyone who are practicing homeopathy. Of course, you get some tips out of it so that you can directly find the medicine in the short time also if you study the Materia in this way. So we proudly welcome the guest of the day, Dr. AMI.C.SHAH. Welcome, Doctor.
Thank you so much, sir. Today I will be talking about magnesium group of remedies, one of the very important remedy group. Sometimes it is overlooked by other group of remedies. I would just like to present just a second. Is my screen visible, sir?
Yes, everything fine, everything fine.
Okay.
Recording in progress.
Greetings to one and all present over here. Myself, Dr. AMI.C.SHAH, and I will be presenting magnesium group of remedies. Now, we all know, we all are aware of magnesium group of remedies. Today, the learning objectives of today's session. First, I would like to introduce the metabolism of magnesium in the human body, understanding the physiological concept of magnesium, so that we can very well understand the applications, because it is very important to understand the magnesium metabolism, and that would help in evolving the scientific understanding of magnesium group of remedies, the symptoms which we can understand in a better way if we try to understand the utility, the physiological role of magnesium in the human body. Okay, magnesium is one of the very abundant element in the human body. It is found majorly, it is found into the intracellular spaces. It is one of the important constituent of mitochondria, and thereby we can understand that magnesium is very important for all the physiological processes, particularly ATP synthesis. And hereby we can understand that it has wide spheres of action. When I talk about magnesium group as well, magnesium group remedies have wide spheres of action. It has action on each and every organs, right? So from here we can understand how important it is. About magnesium majorly, it is majorly found in the intracellular spaces, and when I talk about in blood, it only 1% of the magnesium is found in the blood. Rest of the magnesium is in the body, majorly found in the bones, muscles, and soft tissues, as well as liver and other organs. Right. Almost in our body, we have 22 grams of magnesium, out of which 99% is found intracellularly. And magnesium, how it is regulated, the regulation of the magnesium. So when we take food, it is digested into GI system, and magnesium is absorbed into from the intestines. It goes into blood, and from blood, it major of the magnesium goes into the bones, and it is also filtrated into the kidney, wherein it is reabsorbed again by in the loop of the Henle. So in this way, the magnesium, it is maintained in our body. We eat it is absorbed in the intestine. Some of the portion is excreted into the fecal fishes. Then rest of the thing, it via blood, it enters the kidney. Filtration occurs. It is again reabsorbed in the loop of Henle, and then the excess of magnesium, it goes into the bones and the muscles. So in this way, the homeostasis of magnesium is maintained in our body. Now coming to the physiological actions, right? As you can see that it has wide spheres of actions. It acts on the brain, it acts on the muscles, smooth muscles, cardiac muscles, everywhere. And what it produces, it is important for contraction and relaxation of the muscles. And hence, from here, we can understand its role as antispasmodic. Right. So in the arteries, it causes vasodilation. GI system, when I talk about GI system, liver is one of the very important part. And magnesium group of remedies, as we all know, it has very good action on liver functions. Right. Glandular affections are very well marked in magnesium group of remedies. Glandular affections, liver, breast, testes, all the organs are affected. And what we see is induration and inflammation. And particularly liver affections are very well marked, especially in MAG-carb and MAG-mule. When I talk about skeletal muscles, it is one of the important. It plays important role as calcium antagonist, and hence it is its role. It can be understood that it relaxes the skeletal muscles. So when there is deficiency of magnesium, what we see various spasmodic affections, as well as CNS affections. And from here, we can understand that magnesium has role as antispasmodic. Neuralgic affections, in also neuralgic affections is also useful. Epileptic conditions, neuralgic pains, spasmodic pains, everything can be understood if we understand the role of magnesium, physiological functions of the magnesium. Bones, it is one of the, again, important constituent. If it is deficient, it can lead to osteoporosis. Heart affections, it plays a vital role in regulation of the blood pressure. And in liver, it plays a very important role in metabolism, carbohydrate metabolism, gluconeogenesis. And from here, we can understand that magnesium group of remedies have important role in diabetes as well. Okay. So bone development, it also plays a vital role in neuromuscular functioning, energy storage, gluconeogenesis. All metabolic processes are regulated with the help of magnesium. Magnesium is one of the very important cofactor which is useful in the transfer of ATP. It is also responsible for the growth factor and cell proliferation. Now, when I talk about cell proliferation, from here we can understand that magnesium, when we discuss the physical generals, right, we all know magnesium group of remedies has role in even cancerous conditions, right? So from here now again, from physiology I can we can understand the its utility in tumor as well, right? Benign as well as magnesium group of remedies are important for benign as well as cancerous overgrowths. And why it is important? So like, because it has functions over here. So by any means, if it gets hampered, then it can lead to abnormal cell proliferation, leading to tumors and even malignant conditions. So in short, magnesium is one of the plays a very vital role in all the processes, particularly its main important function. If I want to gist about it, acts on muscles, CNS, nerves, liver, and it is proliferative functions which can be understood. We can understand the pathology of magnesium group of remedies, that it starts from simple inflammation. It covers the simple inflammatory processes, and it can go till tumor degenerative processes like necrosis as well as tumor. Benign as well as malignant tumors are well covered by magnesium group of remedies. Now coming to the homeopathic understanding of the magnesium group of remedies. So homeopathic understanding, before that, the list of remedies, important remedies, we all know that is magnesium carb, magnesium mure, magnesium phos, which are frequently used. Some of the rare remedies, that is mag sulf, mag brom, magnesium iodum, magnesium fluoratum, aceticum, and magnesium silicatum. These are the remedies, few remedies belonging to magnesium group. Now, understanding the spheres of action and pathogenesis of magnesium group of remedies. Right. So over here now, again, I would like to correlate the spheres of action and pathogenesis with the understanding of functions of magnesium in our body. Most important functions when I talk about muscles and bones and how it regulates the contraction and relaxation, it affects the calcium, influx of calcium, and via influx of calcium, calcium is responsible for contraction of the muscles, and then after later on the calcium goes out and then magnesium comes in, and it has a relaxing effect on the muscles. And thereby, we can understand that magnesium has role as antispasmodic. Bones, magnesium has also a vital role in the functioning of the bones as well, formation of the bones. Along with calcium, magnesium is also one of the important constituent of bone formation. Then it affects the mucous membranes. Mucous membranes are affected by magnesium group of remedies, and thereby what we see results that it produces catarrhal inflammation of the mucous membranes, whether it is I talk about respiratory tract or GI tract, or it could be urogenital tract. Anywhere mucous membranes, wherever there is mucous membranes, what is the action of magnesium group of remedies on the mucous membranes? It produces inflammation of the mucous membranes, and thereby what we see, we have discharges which are sour discharges, profuse discharges. Nasal discharges, you have nasal discharges with obstruction of nose, right, which we study in magnesium carb as well as magnesium mure. Coryza-like symptoms before the commencement of the menses. So this is the spheres of action, that magnesium affects the mucous membrane of the respiratory tract, of GIT, of urogenital tract, and thereby what we see that it produces catarrhal inflammation and resulting into discharges which are sour and offensive. All the discharges when I talk about, whether it is perspiration or stools or vomiting or anything, like all the discharges, the nasal discharges, all discharges are very offensive, sour discharges. Even menstrual flow, that is also offensive, right? So mucous membrane per it has great effect. Now coming to a particular system, right, GIT, it acts on the GI mucous membrane. Stomach is affected, and thereby what we see there is acidity. Sour eructation. It produces catarrhal inflammation of the mucous membrane of the stomach, resulting into increased secretions, and thereby what we see is increased secretions, that is HCl would be secreted into excessive amount, and this results into acidity. And magnesium group of remedies, as we all know, that they are good for acidic, they have sour discharges, nausea, vomiting, and they are good for acidity. So this is the action, right? How magnesium acts. Then coming down to intestinal tract, intestines, now what are the actions of magnesium? That it produces constipation as well as diarrhea. Both things are seen in the intestinal actions of when I talk about magnesium. Magnesium, then blood and nutrition. Another important aspect of magnesium is blood and nutrition. It affects the nutrition, and what we see is it affects the nutrition. It produces, there is assimilation is would be not occurring properly, and due to improper assimilation of the food, the nutrition would be impaired, and what we see, the resultant symptom is emaciation. Malnourished conditions, emaciations, marasmus, its utility in marasmus as well. And this again is very well explained by Dr. Kent in his textbook, that he has treated so many cases of marasmus with help of this magnesium group of remedies. So nutrition is impaired, and thereby what you see on the effect, the pathogenesis level at the level of body, there is emaciation. CNS again, that is one of the very important function. Like magnesium affects the CNS, it affects the nerves, and nerves are in state of irritability, and what resulting into neuralgic pains. If we have magnesium phos, particularly when I talk about, even magnesium carb, magnesium mure, also we have neuralgic affections very well covered by magnesium group of remedies. So it affects the nerves, producing neuralgia, and the pains. You have severe shooting, tearing pains in magnesium group of remedies. Urogenital tract, particularly it affects the female genital organs are affected, and resulting into resultant symptoms, what we see, that is menstrual discharges which are thick, tarry discharges, offensive discharges, and usually occurring at night. We have scanty menses, and usually that is menstrual symptoms, flow is more at night. So that is the spheres of action and pathogenesis of magnesium group of remedies. Now coming to the constitution, the look of the magnesium group. The magnesium group, the physical makeup, when I talk about, the persons are stout, fleshy, fair, flabby. Now, when the term comes fair and flabby, right? Another group of remedies which come into our mind, constitution, when I talk about, that is calcarea group of remedies. Calcarea group of remedies also have this type of constitution, that is they are fair, fatty, flabby, right? But there are some peculiar differences which we'll talk later on. So physical makeup, the that is stout, fair and flabby. Skin is pale, oily, waxy look of the skin, and there is tendency to slow healing in magnesium group of remedies. Temperament, you have nervous temperament, anxiety, there are lots of anxiety, they are nervous. Thermally, thermal relationship, all the magnesium, all magnesium group of remedies are chilly and sensitive to cold. But in magnesium mure, even though they are sensitive to cold, but one magnesium mure, they are even better in open air. So that is one exception, that magnesium mure has complaints, the pains are better in open air. Otherwise, all the medicines, they are extremely sensitive to cold air. chilly, and they are aggravated from cold and better by warmth. Now, miasm, it covers all the 4 miasms, right from psora, psychosis, syphilis, and tubercular miasm. Next, that is mental generals. Now, mental generals are the very important part of magnesium group of remedies, that which helps us in differentiating magnesium group of remedies from other groups. Magnesium belongs to group 2A series, right? It is alkaline earth metal and other. The common theme when I talk about group 2 elements, the theme, central core or theme of group 2 elements, that is, one is security, dependency, need for love and support. Now, dependency, when I come to magnesium, the dependency is particularly emotional dependency, what we see in magnesium group of remedies. They want security. There is a need for love and support. Now, over here, again, group 2 elements, this theme will also see in calcium group of remedies as well. Calcium group of remedies also have this security, need for support. They need support, they need security, and they are dependent. But uh, when we try to look into the childhood or life space, how can we differentiate magnesium and calcium group? So calcium group of remedies, when we see that right from the childhood, they are being very protected, overprotected childhood. While in magnesium, there is need for love, support, which they are not getting. The childhood, there is either single parent or unwanted feeling. So right from the beginning of the life, there is a feeling of unwanted, and in this aspect, we can differentiate magnesium and calcium. Now coming to the main theme of magnesium group of remedies, main theme, central idea of magnesium, central theme of magnesium, 3 things. That one is rejection, repression, and pacifism. This theme of rejection, they are being rejected. There is a sense of their insecurity. Why this insecurity develops, the sense of insecurity? Why do they have magnesiums have insecurity? So when we try to understand how this insecure feeling, how they become insecure. So as we have discussed, that there is need for love, affection in group 2 remedies, which they are not getting, and from there comes the insecurity, and they start feeling rejected. There is sense, they start feeling forsaken. They are being not taken care of. They are not getting love, affection. What the basic need of magnesium is, the love and affection, and they are not getting that love and affection. It could be either there are so many causes, right? Nowadays, both the parents are working. They are unable to give time to their kid, and then the child starts feeling rejected, or it can feel neglected. Other things wherein this rejection or neglected feeling can develop are both the parents, there are lots of conflicts going on with the between the parents, lots of quarrels going in between the parents, and this is affecting the child psychology, and he starts feeling being neglected. Or there can be divorced parents, single parent, either single handed, either mother or father is taking care of the child. So they have to take care of the financial burdens as well, and so they are unable to give proper time to kid, and this can later on give rise to the feeling of being neglected in magnesium. Or it sometimes it can occur that was unwanted, the child was unwanted, that was unwanted pregnancy. Right from the pregnancy period, there is a feeling of unwanted, and this can give rise to feeling of being forsaken or neglected feeling, and this eventually ends up into the feeling of rejection. Then next is repression, right? Rejection feeling or neglected feeling, forsaken feeling, right? The main feeling, as I told, that is need for love, care, protection, which is not being fulfilled, and this gives rise to the feeling of orphanage. Now, repression. Repressed feeling, this magnesium patients, right, they are feeling forsaken, they are feeling being they start feeling neglected, but they try to push, that can give rise to temporary state of sadness, but they consciously try, they push the emotions, and at a at point in their life they are so repressed, the emotions are so pushed away that they are even unaware of their these feelings. That's not expressed at the conscious level, right? So that is repressed emotions. There is difference between repression and suppression. Repression is, there is unnoticed thoughts, they are being unconsciously pushed. Whereas suppression, we are consciously trying to push our emotions back, trying to get rid of unwanted thoughts. So this is the basic difference between repression and suppression. And this will help us in differentiating the magnesium group of remedies and natrum group of remedies. In natrum group of remedies, what we see is suppression. They are trying to suppress their emotions. Right. Whereas in magnesium, what we see, that is repressed emotions. Patient is unaware of all these things, that these emotions are there and they have affected me. So that is uh, the repression, theme of repression, what we come across in magnesium group of remedies. The repressed, and this repressed emotions, now they can be manifested in two ways, right? Some repressed emotions, they can be manifested in form of dreams, and in dreams they have lots of dreams of fearful dreams, they have dreams, unfulfilled dreams, and or it, repressed emotions can be expressed at the physical level in form of psychosomatic diseases, right? And we all know that magnesium group of remedies are very important for group of remedies, especially in all autoimmune disorders, right? So it can either, this repressed emotions can be expressed in the form of dreams, or it can be expressed in the form of anxiety, or it can be expressed at the physical level in form of somatic diseases. Another important theme is pacifism. Now, see, understand, they are not getting love, affection. This is the core feeling. Right? So they turn pacifist. Why pacifist? They what they feel, that if they would never retaliate. Magnesium children or magnesium persons would never retaliate or go against or tell, or even they are so would become so undemanding because they are trying, via this they are trying to at least gain whatever love and affection they are getting. They don't want to lose that, they want to be in that, and for that they keep on uh, molding themselves a lot. They would accept all the things. They would never demand anything from their parents. Whatever they are getting, they would be happy with that. They would never demand anything. So what they resort to, they would never be aggressive. They resort to pacifism. They and they are sensitive, pacifism, and then they are sensitive to any kind of aggression. They cannot tolerate any form of aggression. They love peace and harmony in their life. So they resort to pacifism. They don't want any conflicts. So to avoid the conflicts, what they would manifest, they would become calm, contented. They would be happy in whatever they are getting. Rather than complaining, they would just accept the things, and they would be pacifist. One more thing, magnesium group remedies are sensitive. Their sensitivity is very well marked in magnesium group of remedies. This again, if I try to talk about the chemical properties of magnesium, the magnesiums we all know that they are very inflammable. They would easily react with oxygen. They would oxidize immediately. They would form compounds, right? That thing can be applied over here in understanding the sensitivity. They are very sensitive to criticism, sensitive to rudeness, sensitive to aggression. They would hate violence. This sensitivity is so much that they would avoid any TV shows even where there is violence, lots of violence. They would avoid quarrels. They would avoid violence. They would just go away from that. So that is what we see in magnesium group of remedies. That the most important three themes what we see is repression, pacifism, and another, that is, can anyone tell? Okay. So the core theme is rejection, repression, and pacifism. So now understanding it in a flow chart, right? Right from starting from, if I talk about that, there is the basic need of human being is there is lack of love, which is not being fulfilled. There is lack of love, care, affection. So what this thing would give rise to feeling of being neglected. So the reaction, what we see, the patient might become sad, dissatisfied. The child can become sometimes, at times, angry even. But all these feelings of being sadness or dissatisfactions are repressed. They are repressed, and what you see at the in the behavior of the behavioral changes in magnesium, they become very quiet. They are very calm, quiet, and they become non-communicative. They become introverted and resort to pacifism. Now they are not getting love, care, affection. What you see, they start becoming independent. They become self-sufficient and they are not dependent on anyone. This also gives rise to strong sense of duty. They develop a very strong sense of duty and responsibilities. Now, what happens over here in magnesium, that they develop this strong sense of duty and responsibility, along with this pacifism, along with this nature of being molded very easily. They would be unable to say no to anyone. So what happens? They take up so many responsibilities. Now, after taking so many responsibilities, what they find it difficult to cope up with so much of responsibilities, and this difficulty then is manifested in form of anxiety, in form of nervousness and fidgety. They develop lots of anxiety because, like, they take lots of responsibility, they find themselves unable to fulfill that responsibility, and what you see, that is anxiety. Right? They become nervous, they become anxious, and there is a fidgety feeling as well. It's sensitive. As I told you, they're sensitive. This leads to them to become introverted. There's repression, and this repression can be manifested in form of dreams, or at the physical level in form of diseases. And dreams, particularly, what would be the dreams? Dreams of fire, unfulfilled desires, dreams of saving someone, dreams of death or dead relatives, right? These are the dreams which we come across in magnesium group, and dreams are the reflection of repressed emotions of magnesium. So now, in all, if I want to make you understand it, what is the need? Magnesium group of remedies. The need is, they want love, fear of forsaken. They want harmony and peace and how they would react. So the reactions are calm and contented. Right? So the need is for love. They are not getting that love. So there is fear of forsaken or fear of being rejected. Right? They are being rejected. And then what they want harmony at the end. So in order to maintain the harmony, how would they react? They would react in a very calm and contented way. They would never demand. They are undemanding children. They would never demand anything. They are uncertain in their relationship. So Netram, when we talk about Netram, there is newly formed relationship there. And when it comes to magnesium relations, they have formed the relationship, but they are very uncertain in the relationship, whether it would be successful, how much durable would it be. So they are uncertain in their relationship. In this newly formed relationship, they find themselves very uncertain. And later on, there are all chances that they can develop the feeling of neglected or rejected feeling, and thereby you see the entire core theme of rejection, repression, and pacifism developing hereby. And so now they become, as I told you, they become very adapting in order to receive love, right? The core feeling that there is need, what we are talking about, there is need for love. So they, in order to receive what even a small fraction of love, how they start behaving, they become very adaptive. They would start molding themselves according to others' wish. They would never stand up for themselves or never get angry, and they would resort rather to pacifism. They would be very passive, and just to get small fraction of love and affection, they would start becoming adaptive. So magnesium group are they are very adaptive, they are very contented, there is no desire, what we say, or there is no dislike, whatever there is, they would accept. Okay. So there is no desire, or they are very contented persons. And this contentment over here comes out of the fear of loss, of losing that love and affection. So they become very contented because they don't want to lose what they are getting. Right. So they resort to contentment. They become very pacifist. Whereas in opium, what we see, the opium also has that contented feeling, but that is after achieving something, there is contentment. So this is again difference between the magnesium contentment and opium contentment. Opium or magnesium are there, they are getting or not getting, they are contented. They are not getting, even if they are not getting, they are contented. And why contented? Because there is fear of losing that love and affection which they are getting. They don't they want to lose that love or affection. Smallest fraction of love or affection what they are getting, they don't want to lose that. So what they would resort to, they would be very contented. Now what happens, right? In spite of putting in so much efforts, they are trying to be adaptive, they are trying to be contented, they are trying to maintain peace and harmony. Even in spite of giving lots of efforts, if they don't succeed in their efforts, what happens now? So now, if they don't succeed, right, this repressed emotions, the repressed emotions start coming on the surface, and they are manifested in the form of anger. And now what we see, the sour temperament, right? Magnesium carb, they become sour in behavior as well. They lose their sweetness, they lose their sweetness and start becoming sour in behavior as well. There would be outburst of angers which we can see, right? Or other possibility, this repressed emotions can be manifested at the physical level in form of somatic diseases. Right, so repressed emotions, right? If they fail to cope up, right? If they fail to cope up with this things, in spite of giving lots of efforts, putting lots of efforts, if they fail, then this is what occurs, that anger starts coming to surface, they become sour, they lose their sweetness, and or this repressed emotions can be manifested at the physical level in form of somatic diseases. Okay. Now, dreams. Dreams, again, as I told you, dreams of magnesium, subconscious level. So, dreams, there are again two possibilities. Either there are some set of magnesium people who have no dreams at all. And mind well, in this set of persons, the degree of repression is to a very great extent. Right. So you have in dreams of magnesium two sets. Either you have lots of dreams, or there is another set of people wherein you have no dreams at all. And this is more dangerous situation wherein the repressions are the repressed feelings are at a very deeper level. And that is not even reflected in the dreams as well, in the subconscious mind as well. Right. And when I talk about dreams, so what are the dreams? They have dreams, that is unfulfilled dreams. I wanted to pursue degree, right? But due to circumstances, I was unable to do that. So that would be reflected in the dreams. Their dreams of studying or dreams of completing the college. Another set of dreams, what you see is dreams of being left alone. They are traveling somewhere with a group, and suddenly they find themselves alone in the forest, lost into the forest. So dreams, again, that neglected feeling of forsaken feeling, that repressed feeling is expressed over here in the form of dreams of being left alone. Dreams, they can have dreams of shame or guilt, as if they have committed something, some bad. Those kind of dreams they are going into swimming for swimming. They have removed their clothes, and they find that someone has stolen their clothes, and they are in a state of guilt. So these are dreams. Again, these are repressed emotions which are reflected into the dreams. Next is emotional dependency. What we're talking about, that emotional dependency would be exhibits of emotional dependency, that would be manifested in the symptoms like what we see, that is homesickness. Right? Homesickness is found. There is desire to be carried, sensitive to rudeness in general, and even there is ailments from rudeness of others. Okay, so that is the with this, we have understood the mental genders of the magnesium group. Now, coming to the physical genders of the magnesium group. The physical genders, the most important thing is usually all the remedies of magnesium group of remedies, side affinity when I talk about, they are right-sided, extremely chilly, sensitive to cold air, have aggravation from cold, and amelioration from warmth. Exception is magnesium mu, wherein we have patients, the pains are better by moving in open air. The all the discharges are sour, offensive, tarry. They leave stains and that is difficult to wash off. We have peculiar desires in magnesium group, desires for meat, desire for vegetables, and there is aversion to milk, aversion to cooked food. Another important physical general which we see in magnesium group of remedies, that is marked periodicity. The complaints reoccur every second day or every 21st day. So there is marked periodicity in magnesium group of remedies. Whether it's neuralgic affections, there is marked periodicity in the neuralgic affection. The complaints reoccur again and again. Right. Nutrition, that is lack of assimilation, which results into emaciation, malnutrition, and it is one of the important remedy for marasmus, as we had discussed previously as well, when we were discussing the spheres of action and pathogenesis. Sleep. How sleep, magnesium group of remedies as insomnia, sleep, you have unrefreshed sleep, patient wakes up in a very state of irritability is in the morning. The mornings are very miserable for magnesium group of remedies. There's aggravation, that a general state of irritability in magnesium group of remedies in the morning. Another important physical general tendency to spasmodic affections, right? Cramps, convulsions, tetanus, migraine, tension, headache, right? These are the spasmodic affections wherein we can think of magnesium group of remedies. Then tendency to glandular affections. Glands are affected, lymph nodes, liver, prostate, breast, and thyroid affections we find in magnesium group of remedies. The glands are indurated, inflamed, and painful. Okay. And pains. Now talking about the pains. How are the pains? The pains, you have crampy pains, constricting pains, neuralgic pains, stitching pains, all types of pain, cutting, boring type of pains in magnesium group of remedies. And these pains are better by heat, better by pressure, better by bending double. And they are aggravated by touch. And particularly when I talk about liver affection, they are aggravated by pressure as well. So, in short, these are the few important physical generals. Other physical generals, GIT stools are you have yellow greenish stools are offensive stools. Then liver affections, liver region is sore and sensitive to touch, painful, very painful. Colic, we have nausea, vomiting, again vomiting, bilious vomiting, offensive sour discharges, menses, menstrual discharges, they are thick, tarry discharges, menstrual discharges, especially here before menses, the complaints, you have complaints like cholera-like symptoms or coryza-like symptoms before the commencement of the menses. Leukorrhea is also offensive. And general modalities, when I talk about general modalities of magnesium group of remedies, all the magnesium group of remedies are aggravated by cold, touch, early morning aggravation, 7 a.m. aggravation by motion, and amelioration. The magnesium group of remedies have amelioration from warmth, amelioration from pressure, and amelioration from bending double. Now, next we are going to understand the relationship. Magnesium group of remedy are closely related to calcarea group of remedies. Magnesium is closely related to silicia as well, natrum as well. Right. So now, when I talk about calcarea group of remedies, there are so many similarities between magnesium group of remedies and calcarea group of remedies. In both the remedies, we have tubercular miasm, tubercular diathesis. Their constitution also, they have to some extent similar: fat, pot-bellied abdomen, or emaciation. Both remedies we have calcarea group of remedies also we can see emaciation as well as fatty constitution. The
Doctor,
discharges, yes.
Doctor, we can make another session for this comparative material media. So you can go to the case presentation.
Okay, fine. So now case study. I've just listed out in a very short. This is a case of 49 years male patient. He presented to me with complaints of sleeplessness. This is a recent case. Patient came to me in September. What he was complaining about, that he has complaints of sleeplessness, especially in summer. In summer, that is May, June. But this year, it had continued for a longer period of time. Still, he was having that sleeplessness. And then he was unable to sleep whole night. And during daytime as well, he was unable to sleep. Another thing, he had decreased appetite. So he took allopathic treatment because he was suffering from since so long. He took allopathic treatment as well, but it was not giving any relief. He was unable to sleep. There was no improvement in the complaints of sleeplessness. So investigations were done. He was investigated. The blood reports were done, and sonography was also done. USG abdomen is suggestive of grade 2 fatty liver changes. Now, this is again very peculiar thing. When there are some liver dysfunction, there will be some changes at the level of digestion. But he was not having any digestive troubles, no indigestion or anything. Only thing what he came with was the complaints of sleeplessness. Again, over here we can understand the liver. The function of the liver is metabolism. When liver doesn't functions properly, there will be building up of the waste products into the blood, and due to this, it can lead to sleeplessness. Again, this concept is very well explained in Vitholcus, that liver affections and its correlation with insomnia or sleeplessness. Right. And the cholesterol levels were slightly elevated. Rest of the reports, the ECG, FBS, TSH, everything was done, which was normal. Right. In chief complaints, only this much was there. So then I went to past history. Past history also was not very significant. He was not having any significant history of any ailments. One peculiar thing what I noticed in the family history, strong history of cancer. His grandfather had cancer, throat cancer. He died at age of 59. His elder brothers, there are four brothers. Elder brothers died of, again, both elder brothers died of cancer. And then again, this over here, if we see the family history as well, the pathology had progressed silently. There was suddenly, they were in both the brothers that it was detected at a very late stage when the cancer has almost progressed, and there were no scope, and both the brothers died out of cancer. And mother had asthma, and she died of heart diseases. It was sudden, that was not very well mentioned. But then looking into personal history, all the things, I was not getting much of peculiar things in personal, except perspiration, which was profuse and offensive, and thermals, which patient can tolerate heat as well as cold very well, but patient was towards chilly, right? Even in summer, he didn't wanted fans. So that was towards chilly. Then I started investigating the life space, the nature. He gave me very vague symptoms. Like he doesn't have any complaints right now. He's okay. But then when I introspected into his life space, I asked from the relatives, and what I got the history that the relationship with father, right, that right from the childhood, they are not very good. Here, this patient had no attachment with the father. The childhood was very harsh. His father used to beat them all, and not only him, right? Even his mother. What was being told, that they have never received any affection from the father at all. Right? And uh, at recent episodes, like when I inquired about, that is death of brothers. So what he told her, he was affected, but then he had accepted the things as well, because it was not in our hand. It was detected at the end stage, right? This was very peculiar thing, which helped me towards the prescription. Otherwise, complaints, if I see about it, I was juggling, right, what to do. Then I got into it. The history from the relatives, right? This, and then when asking, confirming it with the patient as well, and this was the thing which, on the basis of which I prescribed magnesium group. In this case, I gave magnesium carb. Magnesium carb 1 m was given, and I'm still waiting, because still the 3 months have not completed. So I'm waiting for the reports after 3 months. What are the changes at the USG level? But at the physical level, of course, he has improved a lot. The appetite has increased. He had some developed some sourness in his temperament, which is now better. And of course, in sleepless, this insomnia also, he's better. So he's improving in general. Okay, this is first case of magnesium, and another case is a case of female, a 21-year-old female patient. She PCOD. That's a case of PCOD, presented with complaints of delayed irregular menses. scanty menses. Since 2 to 3 years, she is having these complaints. They are very painful, spasmodic, severe spasmodic pain during menses associated with nausea. Patient had leukorrhea after menses, which is again profuse and offensive. Again, in this case as well, right, when I went to the life space, what I got is like she told me that after the birth of brother, she was not taken care of by mother. She just left her. She had grown up on her own. Her another auntie used to take care of her. Father used to take care of her, but mother has never paid attention. Even she is a student. She had taken admissions into medical college. Yet she is not the mother. She was not happy with that as well. That decision as well. She used to quarrel a lot with this girl. But the reaction when I see that, in spite of such reactions from her mother, what I saw that she is like very calm, very contented. She would tolerate her angers, and rather she was very understanding. Okay, it's okay. She is my mother. She like that. What that calmness which I am talking about, contented, pacifism. If I revert back, there would be unnecessary quarrel. Why should I do that? She is my mother. It's okay. If she, and another important thing now over here, she had never developed that towards brother. She was not jealous. There was no tinge of jealousy even over here. She was like she used to take care of brother as well. She used to love her. She used to take care of her brother as well. So in this case as well, the theme which was was talking about, that feeling of being neglected, left alone. In previous case as well, what we saw is feeling neglected, feeling forsaken feeling, right? There was not receiving love and affection from father, and over here mother, right? And the reactions when we talk, even in the previous case, the patient had no complaints at present when I talked, when I was taking confirming the things from him. So then, no, I don't have any complaints. But one thing was there, that he told me that I am unaffected by the presence of my father. He used to take care of expenses. The father is staying with them only, but they are not into a very good talking relationship, but still he would take care. But then, so that theme what I am talking about, that emotions, at the level of emotions also there was repression, and this theme of being neglected feeling, rejected feeling, are very well reflected in both these cases. And from this I was able to go to magnesium. In this case, I had given magnesium mu.
Okay, okay, madam. Let us only just 2 minutes remaining. Yeah.
Okay,
Okay, we can conclude the session, and
okay.
you can you can say you can say the conclusory now.
So the conclusion is like the theme is the basic, the case, both the case have forsaken feeling, repressed emotions, and pacifism, which are very well reflected in the both the cases. That's a most important theme of magnesium group, and this helped me in this selection. Okay, so with this, I would like to conclude my session.
Yes, we can have another session on the same subject so that you can present more cases, as well as we can have discussion, and you can go ahead with the comparative mathematics also. Anyway, congratulations to Dr. Amit.Shah for his excellent presentation. I invite Dr. Ram Paresh sir to say vote of thanks to the session. Please.
Thank you, Dr. Dhaneji, and congratulations, Dr. AMI.C.SHAH. Very nice presentation, excellent session,
Thank you. Thank you so
and
much, sir.
broad uh, describe the magnesium group of homeopathic medicine, physical and mental, emotional, and uh, elements, role of elements. So very thanks. IFPH, behalf of IFPH, very thanks again presentation. Thank you. Very nice.
Thank you. Thank you so much, sir.
Thank you, Dr.
Okay,
Amresh,
okay.
the
See you.
comments here. And thank you, Dr. Shah, for your excellent session here. We can definitely have some more sessions from you so that you can complete the session, as well as we need discussions on the subject also. Many people want to have questions to raise. You can definitely go ahead with them in the coming session. And tomorrow we will have a session from Mr. Nishant Jain, CEO Jain Group of Companies, and he will be talking about quality consciousness for homeopathic medicine. That's a very important subject to be discussed. So hope all of you will be with us tomorrow at the same time. I hope you can watch the session video tomorrow, same time in the YouTube also. Please like it and share it with your friends so that homeopathy will reach all the houses all over the world. Thank you, Dr. Amit Swanay, Amir, for your presentation once